Welcome to daily coverage on I2OD from Vision Expo West in Las Vegas. We're joined today by Dr. Ben Gaddie from Louisville, Kentucky. Thanks for joining us, Ben.
Thanks, Derek.
Ben, you talked a lot about Meibomian gland disease and really how our evolution or our understanding of it has changed significantly over the last several years. Can you address some of the points that you've discussed?
Yeah, well, Meibomian gland dysfunction is a disease that really didn't exist before Dr. Donald Korb really coined the dysfunction term. And in fact, in optometry school, we very rarely even looked at the lids in terms of the glands being a functional unit and part of the ocular surface and responsible for maintaining a healthy ocular surface. We know from things like refractive surgery, premium IOLs, specialty contact lenses, multifocal contact lenses, that having an excellent lipid layer is critical to having crisp vision. So that's some of the areas that have really evolved, and it's really evolving into how do we treat the Meibomian glands. And there's traditionally not been a good way to treat the Meibomian glands. The at-home devices, heating devices, really it's hard for patients to stay adherent to therapy. So it remains one of the biggest unmet needs and gaps in clinical care of the ocular surface today.
You brought up a great point. So again, so what do we do? So let's say we go through all these steps, we find out that the glands aren't expressing. What can we do about it?
Well, traditionally we've tried different types of medications, which have all been somewhat effective but not sustainable. You can't put someone on a steroid for the rest of their life. You can't take oral antibiotics every day. And frankly, a lot of the at-home therapies are just ineffective. So now we finally have a technology and a device to treat, not only to diagnose, but also to treat a Meibomian gland dysfunction, and that is the LipiFlow procedure. And the LipiFlow procedure actually delivers heat to the back side of the eyelid, the inside of the eyelid, I should say, to the glands, and it delivers. Right. Yeah. If you try and go through the front of the eyelid, you're going to hit the tarsal plate. You're probably not going to get the amount of heat needed to get the meibum flowing again. So it's not only getting the meibum flowing, it's actually restoring the integrity of the glands. And we're pretty surprised at how many patients of all ages really have obstructed Meibomian gland channels. And by using the Meibomian gland evaluator or something like the keratograph, you're able to actually now visualize those channels. And that's been great to be able to show patients and demonstrate why they're having symptoms. And so we're really looking forward to having a potentially sustainable treatment for Meibomian gland dysfunction.
So the way that you're describing it, looks like we're really kind of moving away from treating symptoms, and actually trying to get at a sustainable, change in the anatomy or the root cause of the disease state itself. Would you agree with that statement?
Yeah, I think it really is. You could liken it to glaucoma. And certainly you don't want to wait for someone to have symptoms in glaucoma, but glaucoma is a disease where you have structural change to the optic nerve, to the retinal nerve fiber layer, to the ganglion cells, which eventually results in functional damage. And so the same thing can be found in the Meibomian glands. You have structural abnormalities that will eventually lead to functional problems on the ocular surface, and at the end of the day it's going to lead to inflammation. And so you have to attack both inflammation and the function of the glands. But what we want to do is try to identify these patients early before they get to a state where it's unlikely to be repaired.
Now at this point, somewhat still, I guess, a fringe technology, and that this is not in every OD's office. Do you think this is something one day that we'll all be doing on a routine basis?
I'm not sure if we're all going to be doing it on a routine basis. There is, of course, a price to any technology, and every practice has to look at their return on investment calculations. But I think you're starting to see it more and more in the optometric office. When this technology first was launched, it was primarily targeted for surgical or ophthalmological practices because of the business model. But I think once we realize the impact it's having on our contact lens patients, on our contact lens business dropout, and certainly patients are more critical than ever, and they want excellent outcomes for their surgical procedures. So I think the pressure will be on as we move forward to really deliver a sustainable treatment. And so maybe not every practice will have it, but hopefully we'll have some internal referral amongst our profession and take over this disease state.
Yeah, it's a cool concept of actually treating the root cause instead of just symptoms. Great stuff. Thank you for joining us today.
Thank you, Derek.
And thank you for joining us on I2OD from Vision Expo West in Las Vegas.